The primary problems of hepatitis B infection are the progression of the disease, particularly to cirrhosis, liver failure, and liver cancer. Early detection of a serious liver problem increases one's treatment options and improves long-term health outcomes. In addition, all sexual partners and close family or household members should be tested for hepatitis B and vaccinated if needed. The primary aim of treating a patient with hepatitis B infection are to prevent progression of the disease, particularly to cirrhosis, liver failure, and liver cancer. Professional medical organizations have developed clinical practice guidelines to help doctors around the world manage and treat people living with hepatitis B infection. The different guidelines include 1. Guidance for adults, 2. Guidance for pregnant women, 3. Guidance for children, 4. Guidance for those who are co-infected with hepatitis C virus or HIV, 5. Guidelines for people with cancer. Please note I have a good news for you before the end of this video. The reason for treatment are based on a combination of 3 criteria. 1. Levels of serum hepatitis B virus DNA in the patient's blood. 2. Serum liver enzyme used to know the health of the liver. And 3. The severity of liver disease. Remember that hepatitis B virus infection can be either acute or chronic as explained in our previous videos. There is no specific treatment for acute hepatitis B, therefore, care is aimed at maintaining comfort and adequate nutritional balance, including replacement of fluids lost from vomiting and diarrhea. Most important is the avoidance of unnecessary medications. Chronic hepatitis B infection can be treated with medicines, including oral antiviral agents. Treatment can slow the progression of cirrhosis, reduce incidence of liver cancer, and improve long-term survival. In 2021, World Health Organization estimated that 12% to 25% of people with chronic hepatitis B infection will require treatment, depending on country and eligibility criteria for treatment in your country. Available hepatitis B virus therapies. Currently, 7 agents are approved for use in the United States for chronic hepatitis B infection: interferon alpha-2b, pegylated interferon alpha-2a, lamivudine, adefovir, entecavir, talbivudine, and most recently, tenofovir. Please subscribe so that you can be notified when we get new information about hepatitis B drugs or better treatment. World Health Organization recommends the use of oral treatments tenofovir or entecavir as the most potent drugs to suppress hepatitis B virus. Note that most countries have a separate treatment guidance. Most people who start hepatitis B treatment must continue it for life. People living with chronic hepatitis B infection should expect to live a long and healthy life. There are decisions people can make to protect their liver, such as seeing a liver specialist or healthcare provider regularly, avoiding alcohol and tobacco, and eating healthy foods. There are also approved drugs for both adults and children that control the hepatitis B virus, which helps reduce the risk of developing more serious liver disease, but there is still no complete cure. But note, very few people with chronic liver disease will clear the virus on their own or with the help of medication. Treatment for hepatitis B fall into 2 general categories. 1. Immune modulator drugs. These are interferon-type drugs that boost the immune system to help get rid of the hepatitis B virus. They are given as a shot, similar to how insulin is given to people with diabetes over 6 months to 1 year. 2. Antiviral drugs. These are drugs that stop or slow down the hepatitis B virus from reproducing, which reduces the inflammation and damage of your liver. These are taken as a pill once a day for at least 1 year and usually longer. It is important to know that not everyone with chronic hepatitis B infection needs to be treated. This can be difficult to accept when first diagnosed because taking a drug to get rid of the virus seems like the first step to getting better. Current treatments, however, are generally found to be most effective in those who show signs of active liver disease. This will be determined by your doctor after through a physical exam, blood tests, and imaging studies such as an ultrasound. So talk to your healthcare provider about whether you are a good candidate for any of the approved drugs. In addition, ask your provider if they participate in any clinical trials that are testing several new hepatitis B drugs. Now to the good news. The most important thing to remember is that hepatitis B is a chronic medical condition such as diabetes and high blood pressure that can be successfully managed if you take good care of your health and your liver. You should expect to live a long, full life. Whether you start treatment or not, it is very important to be regularly seen by a liver specialist or a healthcare provider who is knowledgeable about hepatitis B. The standard recommendation is every 6 months, but some people may be checked more often or even just once a year. During these checkup visits, your provider will monitor your health through a physical exam, blood tests, and imaging studies. The goal of these checkups is to make sure that you are staying healthy and to detect any liver problems as early as possible. Please note that guidelines for the current diagnostic workup and management of hepatitis B virus infection continue to evolve. You are advised to refer frequently to your doctor for the most recent recommendations. Please subscribe so that you can be notified when we get new information about hepatitis B drugs or better treatment options. Thank you for watching.